I'm Maddie. I'm a youth volunteer and I'm at the American Revolution Museum. Today we're going to be talking about basic medical attention. Compared to other wounds sustained by American soldiers, second-degree burns would be considered minor. For simple injuries like cuts and burns, surgeons would treat them through the first intention. What this means is the wound would be cleaned, repaired, bandaged, and observed. This guy has some blistering on his hand, so I'm going to apply an ointment made of egg and olive oil to help soothe the area. If the pain was bad enough, I give him some rum, but he doesn't need it. The first thing a surgeon would do to repair a broken bone is to first set the bone back into place. Once that is done, a roller of linen or tail bandage would be applied to the area. Next, a linen compress would be placed along the bone and secured by a splint. Finally, the bone would be fixed into place to encourage healing and make sure no further harm is done. It was common for soldiers to sustain head wounds whether in battle or when they're not paying attention. The patient might have symptoms such as vertigo, speaking incoherently, or have a wildness to his looks. The surgeon would help the patient to rest, keep them hydrated, and help with any pain. However, if the symptoms don't go away within 2 to 3 days, that could be a sign of something worse, internal bleeding. If that's the case, the surgeon might have to turn the internal bleeding into an external one. I should note that none of these bandages are sterile. By today's standards, about 80% of these soldiers will get an infection from these bandages or from tools not being cleaned.
So, first of all, guys, just a quick disclaimer. Don't actually try any of the stuff you saw in the video here. Least of all, sitting on this. It's very rickety. So don't try and start fires with gunpowder. Wouldn't recommend it, ever. So that, by the way, was an empty cartridge. Didn't do that at all. So don't steal things that aren't yours. So, you know, that's probably a good tip for you. Don't do that, like in a broken arm. And also, if you find yourself injured, sick in any way, so it goes without saying, medicine definitely has improved over the last few years. So go to an ER, go to an urgent care. So don't attempt any of the treatments you saw at home. So definitely go to a qualified doctor. So if you like what you saw, you thought it was kind of funny, thought it was kind of informative, so definitely leave a like, subscribe, hit that notification bell, and yeah, definitely tune in for more videos. This is what I do for you. So yeah, definitely tune in next time, guys. Thanks for watching.
I was gonna say, like, I could see your hand for a second there, but the rest of you I can't see at all. There you are.
Yeah, even with the blanket, this is
unpleasant at best.
Suck it up.
it's a very interesting sensation.